With us, non-surgical cosmetic physician. Non-surgical being key, but you do some incredible treatments. And when we met about a year ago, we talked about acne treatments and how you had helped one student. Tell the story.
Well, acne, as you know, is unfortunately very common. It affects about 75% of the population. At some point during your lifetime, you will suffer with acne. It occurs based primarily on the oil glands that are under the hair follicles. And when you reach puberty, the oil glands are stimulated by male hormones, which both men and women have.
Right.
And more oil is produced. Unfortunately, sometimes the oil will clog the follicles or the pores, and then that oil will accumulate under the skin. It then gets secondarily infected with bacteria.
And as if being a teenager isn't difficult enough,
yes.
It happens right when you're a teenager. You end up with acne all over your face. You don't even want to go into public, never mind go to graduation.
Yeah.
You have some treatment options.
Yeah. So we have incredible treatment options now with acne. And my main advice for patients who I see now with acne, number one, is to wash your face twice a day with a medicated cleanser. I like benzoyl peroxide, which will decrease oil production and kill bacteria. Number two is not to pick your face, not to touch the face. That's very difficult to do, but it's very important. And the third thing is to seek medical attention. See your doctor, because we now have incredible topical medications, oral medications, and a new laser procedure, which I perform now in my clinic, is called photodynamic therapy, or PDT.
Okay, you've got before and after pictures for this. Let's have a look.
And
PDT before.
So that's before, and this patient then went on to have 3 laser-based therapies called photodynamic therapy, or PDT.
Wow.
And that's her after.
That's an untouched photo?
That's untouched, and you know, this is self-esteem. This is a patient who did not want to go to her grad. After 3 treatments of PDT, she now loves her skin.
You can see the smile on her face, even though you covered her eyes. Okay, now acne scarring is also an issue. Those who do pick their faces and go to regret it.
Yes.
We all have people in our family and our circle of friends who, while some of us escape the acne as a teen, others have to deal with it in such a way. And my brother had to deal with it, and he has a couple of little scars. He actually has none of it now.
Yes.
But could he fix just those?
Yes, you can, and we now have incredible laser technology to treat acne scarring, and what I'd like to use is what's called fractional non-ablative resurfacing. In English, what that means...
Say that 10 times fast.
What essentially, we're delivering this array of microbeams of laser light energy into the skin, and it basically will stimulate your body to make your own collagen to smooth out and fill in the scars.
Okay.
Now, for some of the deeper, what we call crater scars that are too deep, we will then inject dermal filler into them.
Oh, interesting.
So the same type of filler we'd use to fill in folds, lines, or lips, we can inject into these deep crater scars and smooth out the skin. So the combination of non-ablative resurfacing to smooth out and stimulate collagen production, and then filler, gives you incredible results.
So we got a before and after of that?
We do. So this, you can see this is a typical patient with pretty severe acne scarring, somebody who probably had pretty bad acne as a teenager. And this is before, and then we did ablative resurfacing. So the scars aren't 100% gone, but you can see that's about 70 to 80% improvement, and then we could even fill some of those scars that still bother him.
Unbelievable. So how many treatments does that usually take?
That's 3 treatments spaced about 1 month apart.
Wow, this is some significant self-esteem that you're sharing with people. So, and it starts simply, if you have problems with acne, is wash your face, benzoyl peroxide, don't pick.
And see your doctor.
And see your doctor, because there are some options to help.
Incredible treatments that we have now.
Dr. Haneef Alibhai's website is here and on our Facebook page. Thank you, as always, for coming. Say hello to your family for us. We're going to take a quick break and wrap up BT in just a moment. It's 8:53. Those are dramatic.